All right, so we are looking at another concept. This is having to do with what? Sex obstetrics. So this is what is known as a postcoital bleeding. Postcoital bleeding, right? They call it cervical bleeding after sex. All right, just have to be what? Bleeding, All right. So what we have, it just refers to what? Vaginal or cervical bleeding that occurs after sexual intercourse. So after to have sex, the woman is bleeding, and so of course anything that has to do with like all this bleeding stuff, we are possibly trying to look at what the possible causes, right? So the bleeding is not related to your menstrual cycle. All right, it can be light bleeding, can be heavy bleeding. All right, it might be normal, not normal, but harmless sometimes. Do you understand? There's sometimes it can indicate that okay, there's a problem that we need to dig for. Right? So what are the possible things that could make a woman bleed after pregnancy? So vaginal issues, like maybe her vagina is dry, maybe trauma, maybe lacerations, maybe an inflamed vagina, that's vaginitis, maybe atrophy. Could be cervical conditions like what? Inflammation of the cervix, that's cervicitis. Could be polyps. Could be what? Cervical ectropion. Could be maybe cervical cancer. Could be infections, sexually transmitted infections like chlamydia, gonorrhea, pelvic inflammatory disease, right? Could be hormonal factors like maybe she has low estrogen, right? Maybe she's on birth control pills. Other causes like endometriosis, uterine prolapse, incorrect placement of what? Intrauterine devices. Okay. So what are the symptoms to watch out for? All right. If there's bright or red or brown blood after sex, right? If during the sex she was having some pains, there was vaginal discharge or itching after the sex, bleeding after menopause, a woman shouldn't bleed, right? Or she has hit menopause, that's bye-bye to bleeding, right? So she's bleeding after menopause, there's a problem. All right, so fatigue or signs of anemia, so she's weak. Maybe she's showing that she has lost so much blood, So diagnosis is what? Pelvic examination and pap smear, ultrasound or colposcopy, STI testing and hormone levels testing, biopsy, all right, if abnormal tissue is found. How about the treatment? If it is dryness, you can use lubricants. Infections, that's when you start exploring what? Antibiotics. Hormonal therapy for anything menopause related. Surgical removal of polyps or any abnormal growth. I brought a picture here. All those growths are polyps. Okay, this one is cancer. All right, possible causes. Then cancer treatment if needed. All right.